Are you a woman over 40 who is suffering with low sex drive or libido and you're wondering what you can do about it? What if I told you there are a few very little known treatments that can turn that around and turn your interest all the way up? I'm Dr. Janet, a board-certified obstetrician gynecologist, medical doctor, an intimate health coach, and hypnotherapist. I help women over 40 clear overwhelm, fatigue, and habits from the past and design a soft life of pleasure that is built to last. In this video, I'm going to talk about 3 of the best pharmacological treatments or medications that your doctor can prescribe for you that will help to improve your libido, even if you are in menopause. Before we jump in, make sure to subscribe to this channel and share this video with someone that you know needs this information. When you do that, it helps other women who need help to find the information they're looking for and get the help that they need and that we all deserve. So what is libido? Libido is essentially low sex drive, and it's the type of low sex drive that is bothersome. It is a persistent absence of sexual desire or the absence of fantasies that cause you to be bothered by it and ultimately can affect your quality of life. When treating low sexual desire, it's important to be evaluated first to make sure there aren't any underlying conditions that are contributing to the symptoms. And that could be things like low testosterone or an elevated prolactin hormone or even abnormalities with the thyroid hormone. So the first step would be to address any of these issues and then reassessing to see if the libido is then improved. So what if everything is normal? You do all of that, everything is normal, and you still have a low libido, or what we know as primary reduced libido. This just emphasizes the importance of the whole person approach. And we can't just approach desire from one aspect, like from the physical aspect, from medications and biology only. But we also have to address any emotional, environmental, and relationship states that we're in. For example, if you have relationship issues or body image issues, these are all things that can impact your libido and won't necessarily be improved at all with medications for libido. Depression, sexual trauma, painful sex, and medication side effects are all things that we need to think about when libido and desire issues occur. I screen for all of these things in the women that I work with because direct libido treatment with medications may not adequately treat or address the libido issue, especially if all of these other things have not been addressed. Treating low libido needs to be holistic in order for it to work, and it requires looking at the woman individually and evaluating what might be affecting her mind, her body, and her environment. So we want to get her mind aligned, her environment aligned, alleviate any stress, and reintroduce ease and soft living. And then medications can also be used if needed. A lot of times when I'm having these conversations, we will separate the women that we're talking about into those who are premenopausal or perimenopausal and postmenopausal or menopausal. Premenopausal or perimenopausal women are those who are still having menstrual cycles and haven't gone a year without a menstrual cycle. And this is even if those menstrual cycles are irregular. And postmenopausal means those who have gone through menopause, who have been a year without having a menstrual cycle, and their last menstrual period was more than a year ago. Now, there are 2 FDA-approved medications for low libido, and those are Flibanserin and Bremelanotide. That's a whole mouthful. Flibanserin is a daily pill that you take by mouth, and that's usually taken at nighttime. It was approved in 2015 and nicknamed the Little Pink Pill. It was the first FDA-approved treatment of its kind offered to women with low libido. And it works by decreasing the chemical serotonin, which is a chemical in the brain that tends to inhibit sexual desire. The medication also works by increasing dopamine and norepinephrine, which are both pro-sex chemicals in the body that excite sexual desire. Unlike some of the medications taken right before sex, this is a medication that happens to work gradually over time. And it needs to be used kind of consistently in order to begin to see the benefit of it. And some women will begin noticing a difference in improvement in their libido after several weeks of using it consistently. With this medication, you have to be very careful with alcohol use. If you have a drink, you'll need to wait 1 to 2 hours from the time you had the drink to when you take the pill. And if you drink more than 2 drinks in that night, you want to go ahead and skip that pill for the night. This medication is also known to make you very sleepy, very drowsy, and can get you into some slow wave deep sleep. Deep slow wave sleep is the type of sleep that helps the body to restore itself. And this might be a great option for women who also have sleep problems. Next up is Bremelanotide. Now, Bremelanotide is an injection that you give yourself underneath the skin. That's done with an easy-to-use applicator pen, very small needle that's almost painless. And this medication releases dopamine. And dopamine increases sexual excitement and increases genital stimulation. And some women will experience increased clitoral sensation. So this might be helpful for those women who are experiencing decreases in their desire as well as decreases in their sensation and arousal. That being said, it's only FDA approved for problems with libido and not specifically for problems with arousal. And this FDA approval is for premenopausal and perimenopausal women and not for women who've gone through menopause and are now postmenopausal. And while it's not FDA approved for postmenopausal women, many sexual health experts use it very safely off-label in postmenopausal women. And by off-label, I mean that it's not FDA approved specifically for use in women in that population. So some doctors may consider using this medication in women who are postmenopausal, carefully selected, with persistent low sexual desire, particularly when other contributing factors have already been addressed. But any treatment decision should undergo thoughtful consideration with the risk, the benefits, and alternatives that make the most sense for your individual situation. Some of the potential side effects of bremelanotide are things like nausea and headache, and in some cases, temporary increases in your heart rate and your blood pressure. So it may not be an option for those women who have high blood pressure that's uncontrolled or cardiovascular disease. Now, a third medication for libido is testosterone. Now, this again is an off-label use of this medication. And off-label just means that it does not have FDA approval for women for the specific indication. But many clinicians consider using testosterone in postmenopausal women who have a low desire, a low libido disorder. So testosterone can be considered for women who have hyposexual desire disorder. And again, this is particularly when those other contributing factors have already been addressed. And I know a lot of people think that testosterone is something just for men, but women need testosterone too. And testosterone stimulates libido and the motivation for sex. And even though it may not be appropriate for use in everyone, studies show that carefully dosed testosterone can significantly improve your desire for sex, arousal, overall sexual satisfaction, as well as your quality of life. So this medication needs to be prescribed and monitored by a doctor who is comfortable with this medication. They're going to monitor your blood work to make sure that the levels of testosterone are appropriate for you. Because it's not FDA approved in the United States, and we really want to make sure that the dosing is correctly monitored so that we don't have any unwanted side effects. For more than 50 years, men have had FDA approved testosterone products to help with their libido. There's over 30 of them. Meanwhile, women, we got 0 FDA approved products to help with our libido. 0, nada, zilch. But that's a whole nother conversation that I talk about in another video that I'll link below. So those are the 3 main medications for libido. But I want to make an important point about pain. Many women experience vulvar and vaginal pain and irritation as a result of perimenopause and menopausal changes that occur in this area of the body. And this can lead to decreases in libido just simply because it hurts. So it's important to address painful sex first when we are first treating desire. When we make sex not painful, we can then work on the desire and libido. For perimenopausal and menopausal women with painful sex, vaginal estrogen can be a life changer. And it's typically the main thing that we use for treatment of this particular problem. But again, it still might just be a part of the issue because it's possible to have painful intercourse and a low libido that's unrelated to the pain. So sometimes we can treat the vaginal pain and still have a libido or desire component that needs to be addressed separately. To sum up, the approach to low libido issues and desire issues in women over 40 that are in perimenopause or menopause requires that our mind, body, and our environment are addressed. What I've found in working with women over the last 20 plus years is that a holistic approach, one that addresses the woman individually, not only with the medication, body side of things, but also with her emotional state and her environmental state. This is when we see the best results and is the best approach to low libido. If you're a woman over 40 struggling with overwhelm, stress, fatigue, libido issues, and you're ready to design a soft life of pleasure that's built to last, check the link in the description and register for my free training to learn about the system women over 40 are using to navigate this transition, wake up their pleasure, and live their best life now and for the years to come. Thanks for watching, and I will see you soon.